Paget's disease of bone is a disorder that interferes with your body's bone tissue recycling process when new bone tissue gradually replaces the old. This process is called remodeling, and it continues throughout your life. Paget's is a serious disease that can cause bones to become fragile and misshapen. The skull, pelvis, spine, and legs are most likely to be affected. The precise cause of Paget's is unclear, although heredity may be a factor. There is also a possibility Paget's is related to a viral infection in your bone cells. This infection may be present for many years before the disease becomes evident. Some individuals never experience symptoms. Among those who do, though, the signs of Paget's often depend on which part of the body is affected. When symptoms do appear, they might include the following: bone deformities. Legs can become bowed, and the head may seem to be gradually getting bigger as the skull enlarges. Bone pain. Pain varies from one individual to another, but it tends to be a continuous, aching type of pain, and it's often worse at night. Joint pain. Paget's can damage cartilage, leading to sore or painful joints. Nerve pain. Discomfort may be widespread, or it may occur only in one or two places. There may be numbness and tingling in some areas, especially the lower back. Double vision, headaches, and hearing loss. These can also be caused by nerve compression. Bladder and bowel control problems. These could be the result of nerve damage in your back. Leg weakness. Bones in your legs won't be as strong because of the abnormal remodeling process. Skin changes. Warmth on the skin over the affected area can occur. Paget's disease of bone happens more often as we get older. There is currently no cure for Paget's, but treatment can help relieve the symptoms. In very rare cases, Paget's can turn into a life-threatening cancerous bone disease. Severe Paget's may cause damage to the heart. If you're experiencing bone or joint pain, talk to your doctor. It could be caused by Paget's disease, and if it is, you'll want to know as soon as possible so you and your doctor can consider treatment options.